Event 201 simulates an outbreak of a novel zoonotic coronavirus. In the tabletop game, the virus is transmitted from bats to pigs to humans that eventually becomes efficiently transmissible from person to person, leading to a widespread pandemic. The pathogen and the disease it causes are modeled largely on SARS, but it is more transmissible in the community setting by people with mild symptoms. The disease starts in pig farms in Brazil, quietly and slowly at first, but then it starts to spread more rapidly in healthcare settings. When it starts to spread efficiently from person to person in the low-income, densely packed neighborhoods of some of the mega cities in South America, the epidemic explodes. It is first exported by air travel to Portugal, the United States, and China, and then to many other countries. Although at first some countries are able to control it, it continues to spread and be reintroduced, and eventually no country can maintain control. There is zero possibility of a vaccine being available in the first year. There is a fictional antiviral drug that can help the sick but not significantly limit spread of the disease. Since the whole human population is susceptible, during the initial months of the pandemic, the cumulative number of cases increases exponentially, doubling every week. And as the cases and deaths accumulate, the economic and societal consequences become increasingly severe. The scenario ends at the 18-month point with 65 million deaths. The pandemic is beginning to slow due to the decreasing number of susceptible people. The pandemic will continue at some rate until there is an effective vaccine or until 80 to 90% of the global population has been exposed. From that point on, it is likely to be an endemic childhood disease. This is where it gets really interesting. Event 201 was a 3.5-hour pandemic tabletop exercise that simulated a series of dramatic scenario-based, facilitated discussions confronting difficult, true-to-life dilemmas associated with the responsible to a hypothetical but scientifically plausible pandemic. 15 global businesses, government, and public health leaders were players, literally reenacting the simulation exercise that highlighted unresolved real-world policy and economic issues that could be solved with sufficient political will, financial investment, and attention now and in the future. The exercise consisted of pre-recorded news broadcasts, live staff briefings, and moderated discussions on the specific topics. These issues were carefully designed in a compelling narrative that educated the participants and the audience. The Johns Hopkins Center for Health Security, the World Economic Forum, and Bill and Melinda Gates Foundation proposed a set of recommendations. The event took place Friday, October 18, 2019 at the St. Pierre Hotel in New York, New York. So basically a few months before the SARS COVID pandemic began. I'll leave it up to your imagination on what's truly going on, but there was also a tabletop game. It was a monkeypox tabletop game played in 2021, simulating the same thing that would happen on May 15th, 2022 in the same fashion. That was the day the first reported cases of monkeypox were confirmed.